every Tuesday for about 60 minutes since March of 2020. We've been hosting Emory Brain Talk Live. Again, on behalf of the Emory Alzheimer's Disease Research Center, we're so happy that you join us each week. Now's a good time to grab a pen and pad, or the session is being recorded, as you know. You can always go over to our YouTube channel, but you've asked us to continue the sessions, and that's what we are doing. However, we are ramping up our in-person program. As you know, twice a year we host our Brain Health Forum. This year, earlier we had it at the Carter Center, and we're going back to the Carter Center on October 18th. So you have to register. It will be a hybrid event. If you want to join us in person, you're welcome to do that. We're going to kind of spread out. We're probably going to go theater style, and we are serving lunch on that day, so you can see us live and in the flesh. But we're also going to offer it to those of you who want to join from the comfort of your home and office. This will be October 18th, but you gotta register, okay? All right, so Dr. Monica Parker is on as well. So if you have any pressing questions that you want to ask Dr. Parker, every few times a Tuesday, she will come in and answer many of your frequently asked questions as it relates to brain health. So she is on, but I think that's all the housekeeping I have. Welcome. Thank you guys again for joining us again every Tuesday. So John Lewis, who is our fitness expert, he comes on and he does a little bit of exercise with us for about 10 minutes. You can go at your own pace. He brings the energy. We love his enthusiasm, and we want you guys moving. You know, movement is life. You need to stay active. So he's just going to give you a nice teaser. Go at your own pace. You might want to go faster than John. You might want to go slower, but you go at your own pace, okay, and at your own risk, all right? So John, take it away. Get our hearts pumping as we kick off Brain Talk Live.
Hey, hey, hey! I want to say welcome, welcome, welcome to the Emory Alzheimer's Disease Research Center. Today, if you have canned goods, if you have any weights or bands, anything you have around the house or your office, get it right now. And if you don't have anything, use your own body weight. So let's get ready to warm up and let's go from there. Or just use your upper body. Let's go. Come on now. Come on. Come on. Watch it now. Watch. Baby, boogie down. Come on. There we go. There we go. Baby, boogie down. Get him up. Bring it down. Baby, boogie down. Keep it going. Keep it going. Lean back. Come on. Come on. Come on. Watch it now. Get him up. Get him up. Get him up. Watch it. Get him up. Come on. Come on now. Get it up. Bring that curl back. Now we're going to get them triceps. Get it up. Let's go. Keep it going. Switch. There we go. Let's go. Bring it back. Come on. Let's get them legs. Them shoulders. Let's go. Keep it. Keep it. Go. Go. Get him up. Get him up. Get him up. Get him up. Keep him up. Keep him up. Keep him up. Keep him up. That's right. Good job. This next one, I need you out your seats. I need you to hold on. Here we go. Hamstrings. Come on now. Come on. Come on. Yeah. Come on. We doing those hamstrings. We working those glutes. Switch legs. Switch.
Settle down, don't waste no time. I'm more love, more hugs, more kisses. Less war, less greed, that's what's missing. Todo problema tiene solución. True love, mucho amor, esa es mi religión. En el hogar que comienza la educación. Amar al prójimo sin condición en la elección. No tengan miedo to reach out.
Come on now, one more minute, stay with me.
Stop stressing.
I'm John Lewis, and see you later. Bye.
Woo! Bravo, bravo. Once again, John getting us moving, keeping us active, just giving you a few tips virtually. So if you're joining anywhere from around the globe, welcome. Give John a thumbs up, an emoji, anything, drop it in the chat. Let us know. Let him know how much you appreciate him. Thank you, John. Yes, every week John kicks us off with exercise and then we delve right into our content. It just kind of refreshes us before we begin to go over all of the great information each and every week. All right, so are you ready? Well, welcome, Dr. Parker. How are you? Tell everybody what they can expect today. And I see you already have some questions.
Well, that's good. I'll keep looking. Anyway, good afternoon, everybody, and thank you so much for tuning into our BrainTalk Live. I think on the carousel, you've seen our program for the next 3 weeks. We certainly hope to keep seeing you every week. I know that Cornelya told you about our forum on October 18th. That's going to be at the Carter Center. Please make sure that you register and sign up for it because we are limiting access. And for those of you who've been with us a long time, you know that that's a big deal. So please try to sign up and register as quickly as you can so that we can accommodate you on October 18th. Today, we're going to hear from our Dr. Liuhua, who is from the Rollins School of Public Health, and she has been studying trends in how air pollution is affecting our risk for developing dementia. And it's been a big area of study. If you've been listening to us for a couple of months, you know that being exposed to air pollution at different points in our lives is a significant risk factor for the later life development of dementia. Or as I said, dementia, and how we've come about understanding these things. At this time, I'd like to introduce all of you to Dr. Liuhua from Rollins School of Public Health. Dr. Shi?
Thank you so much for the introduction. Could you hear me clearly? That's great. Okay, so let me share my screen first. Yeah, so this is Liuhua, and I am an assistant professor from Rollins School of Public Health at Emory University, and I am an environmental epidemiologist. My research has been focusing on looking at the chronic health effects of air pollution and climate change on the older adults' health. And today, I will talk about the associations between long-term air pollution exposure and incident dementia and Alzheimer's disease in American older adults. This is a very interesting topic and definitely a new area of research. There is not a lot out there. So let's start by talking about why should we even think about the neurological effects of air pollution? Dementia is a public health priority with substantial economic and social burden. The most common type of dementia is Alzheimer's disease. Here I show you some projections of Alzheimer's cases around the world. And these three figures show the situations in 1950, 2000, and 2050, respectively. And we can clearly see that the number of AD cases has been going up dramatically. At present, we have about 50 million AD cases globally. And by 2050, it's getting huge. It's going to be tripled, about 150 million AD cases. So in response to this devastating public health threat, the National Alzheimer's Project Act, the NAPA, was signed into law to overcome the Alzheimer's disease and related dementias. And we also call it ADRD. And the national plan to address ADRD was launched. Therefore, to identify and intervene on modifiable factors that could prevent or delay the onset of ADHD is a national priority in the US. Even though the populations are aging, and on the other hand, we have these genetic risk factors, but aging genetic risk factors really don't fully explain the increasing number of ADHD. And recently, there is growing evidence showing that there might be a link between air pollution and the brain disease, particularly, a link between the foreign particle, the PM2.5, and brain disease. So how do these foreign particles get into our brain and have an effect there? There are several ways that particles may enter the human body and influence the brain. So first of all, usually the particles are inhaled through our nose. And once they enter the nasal cavity, they can penetrate the brain directly. So they can directly go to our brain through the nasal cavity. And the other option is that the inhaled particles, they may enter our body through our lungs. And then they can be absorbed into this bloodstream. And through the bloodstream, they can potentially cross the BBB, the blood-brain barrier, and then reach our brain. And also there's another way that once the particles enter our lungs, and they can cause inflammation. So there will be more pro-inflammatory cytokines produced, and these cytokines can enter the bloodstream and have a secondary effect on the brain. So not necessarily the particles themselves, but also, the pro-inflammatory factors can also enter the brain and have adverse effects there. So the neurological effects of PM2.5 of particles is certainly something we need to worry about. In addition, we know that air pollution is highly prevalent and they can influence a large population, and they can also be modifiable by public policy with benefits at the population level. So it is important for us to look at whether air pollution might be a risk factor for neurological disorders. Therefore, we want to investigate the association between the long-term exposure to air pollution and incident dementia in American elderly population. So here we performed a nationwide population-based cohort study. And in epidemiological studies, we have three components. So first of all, we need the exposure data. So here we used the high resolution satellite retrieved the daily 1 kilometer PM2.5, NO2, and ozone data, predicted from the satellite data from those machine learning models. And for the health data, we used the nationwide Medicare data set, which has individual level information for the nationwide Medicare beneficiaries. And also for the statistic models, we performed the traditional survival analysis and fit those COGS models to quantify the chronic health effects of air pollution. So let's take a deep dive into each of these. First of all, let's take a look at the air pollution data. We used the high resolution air pollution data predicted by my Harvard PhD advisor, Dr. Joe Schwartz. We collected PM2.5, NO2, and ozone measurements from about 2,000 air quality monitors across the US for the past 17 years. And we also collected about 170 predictor variables, like the weather data, the satellite data, the land use terms, some chemical transport model outputs, and so on. And then we feed some machine learning models. We feed the 3 machine learning models respectively. And eventually we assembled these predictions. We combined these predictions from each machine learner and generate the final daily 1 kilometer PM2.5, NO2, and ozone data. And we further calculated this annual mean PM2.5 and annual mean NO2 for each year from 2000 to 2016. And for ozone, we calculated the warm season mean ozone. If you are familiar with ozone, you will know that ozone is highly temperature dependent. So in warm season, when temperature is higher, so ozone, it is more readily formed. So it is more of a concern in the warm season. So that's why we focused on the warm season for ozone. And then for each subject, we calculated the 5-year moving averages for annual mean PM, NO2, and warm season ozone based on their residential history, because we want to look at the long-term air pollution, in the past few years. And here shows you our study population. We focused on the Medicare population who are older than 65 years old in the US from 2000 to 2018. Who were enrolled in the Medicare fee-for-service program, who were enrolled in both Part A and Part B program, so that we can have all the hospitalization records. We could also have their medical insurance records like doctor visits, outpatient visits, and so on. And we further applied a 5-year clean period, a 5-year washout period. That means the subjects, they need to be dementia-free in their first 5 years after enrollment, because we are concerned about that some subjects, they might have already developed dementia or AD before entering the Medicare program. So we applied this 5-year washout period to increase the possibility that we are really capturing the first diagnosis of ADRE in his entire lifetime, so that we can better look at disease incidence, or we can see the development of the disease. And then we constructed cohorts for all-cause dementia and Alzheimer's disease, respectively, using all those claims data from the nationwide Medicare CCW database. So we not only have the hospitalizations, the inpatient claims, we also have those outpatient claims, the doctor visits, skilled nursing facility, and home health care claims. So this is a very comprehensive claims records. And then we followed each person until the first diagnosis of dementia across all those claims data. We follow them until, or we can follow them until their death or the end of the study. So this is how we constructed our first cohort for all-cause dementia. And similarly, we follow each person until the first diagnosis of Alzheimer's disease across all those claims. And this is our second cohort for AD. And we identified about 2 million dementia cases and 0.8 million AD cases out of the 12 million Medicare fee-for-service subjects. Then we conducted a statistical analysis, the survival analysis, by fitting those single pollutant and multi-pollutant COX models. Multi-pollutant, that means we put all 2 pollutants or all 3 pollutants into one model simultaneously. And our exposure, as I mentioned, we used the 5-year moving average. That is the average air pollution concentration in the past 5 years. This is our exposure. And then for the model, we stratified on those individual level variables, like we stratified by sex, age, race, Medicaid eligibility, and we also controlled for some neighborhood level confounders, such as the socioeconomic status, behavioral risk factors like smoking, BMI, and adjusted for the healthcare capacity. And also we considered the residual confounding by adjusting for some spatial and temporal trends in our statistical models. And here shows you our results. We found that no matter in single pollutant models or multi-pollutant models, we always observed that PM2.5 and NO2 were statistically associated with increased dementia incidence and increased AD incidence. And particularly, the association was the strongest for PM 2.5 for the fine particles. However, for ozone, we found that ozone, we found that the results were not consistent. So we interpret this as evidence that there's no neurological effect of ozone. So just now I showed you some, like hazard ratio values for their associations. That is, we assuming the relationships were linear, so we can generate one value, right? One hazard ratio value. And here we also looked at the concentration response relationships by fitting some splines. That means we allow the air pollution and ADRD relationships, we allow them to be nonlinear. So if they are nonlinear, these splines, we can capture the nonlinear relationship. And here shows the curves for all these three pollutants derived from the tripollutant models. And this is more obvious. We observed a very strong signal between PM 2.5 and PM 2.5 and both dementia and AD. So in these figures, we can see we observed a very strong signal between PM and both endpoints across all these three pollutants. And then for NO2, we also observed the association. Although the association for NO2 are weaker, are not as strong as our association for PM. For NO2, we observed at first a linear relationship at lower like NO2 concentrations, and then the association level off at higher concentrations. For PM, so we can see they are almost, very linear, right? No matter at low concentration or at relatively higher concentration. So the signal is stronger for PM. For ozone, we almost observed no association for ozone. Since we observed the association for PM and NO2, we further looked at the effect multiplication. And we found that the Black and the Medicaid eligibility people who usually have lower socioeconomic status, and also the urban residents, they are usually at higher risks. And we further conducted a series of sensitivity analysis, and our results are very robust. So we observed a stronger association between PM. And also we observed associations for NO2 and ADRD, but not for ozone. So our work has already been published in the Journal of Nature Communications. And I work very closely with Dr. Cal Steenland, who is my colleague. And we are both the co-leading author of this work. Okay, so we have already observed an association between both PM and NO2 and ADRD. So next, we are going to investigate whether the association implies causation. So that means whether we can say PM and NO2 cause this ADRD. So we need to conduct, the causal inference approaches to investigate this association. The second is that we know PM 2.5, it is very complicated. It is composed of many different substances, the chemical compositions. So we want to investigate which components they are most responsible for this increased AD and dementia incidence. So these two research questions are still open research questions and also our next move. Yeah. So we will keep updating our work in our research website. Thanks a lot.
Thank you, Dr. Shi. Can you go back over what these different pollution particles actually were? What were you measuring?
Yeah, sure. Oh, okay, sure. For this study, we focused on three pollutants. One is PM 2.5, one is NO2, and the other one is ozone. So for PM 2.5, like when we talk about the particulate matter, the fine particulate matter, those particles, whose like diameters are smaller, like smaller than 2.5, micrometers. They are called PM2.5. And NO2 is also a criteria pollutant, a very major air pollutant. And NO2 is usually considered as a traffic indicator. So it used to track the traffic-related air pollution. And for ozone is usually a secondary pollutant. It is generally formed through like secondary chemical reactions of like NO2 and VOC. Yeah, some other pollutants.
So NO2, nitrous oxide, that's gas that's produced from automobiles. And then PM 2.5 particulate matter, would that be something like carbon dust, dirt, like if you live on a farm? What is that?
Yeah, so for PM 2.5, it is, so it is not a like single substance. It is a mixture of many different substances. It can have like those trace metals like lead, many metals, and also it can have those like black carbon, organic carbon, sea salt. So it is a mixture of many different substances. Yeah, but whose diameters are usually smaller than 2.5 micrometers. And PM 2.5, it can be directly emitted from, the coal combustion, the traffic. It can also be like formed through those chemical reactions.
Okay, so when we look at your map here, this one in particular, on the bottom, it looks like there's more pollution than on the central and west coast, like where it's dark purple. Is that what we're supposed to assume?
Yeah, so here, so for ozone, it is, in the Western United States, the concentrations are usually higher. Yeah, it has quite a different spatial pattern than PM 2.5. PM 2.5 is usually higher in the Eastern United States.
So one of our questioners said, well, the forest fires, the wildfires that are out west, would that be adding to the ozone picture in the west versus the industrial east? The top one is about the East Coast, where we have a lot of industry factories.
Yeah, that's a very good. That's a very good point. Yeah.
Okay. Let me see. Okay, would the PM 2.5 content be different in different geographic areas?
Yes, of course. Yeah, so as I mentioned, PM 2.5, it is a mixture of many different chemical compositions. And in the US, in different regions, like for example, in some region, there might be more coal combustion, right? The fossil combustion. Then there might be more like sulfate. And in some other regions, there could be like more black carbon, more traffic related, the black carbon. Yeah, so in different regions, yes, the composition, chemical composition could be quite different.
Okay, so the question is, in these areas, looking at the different types of pollutants, whether it's the parts per million, the nitrous oxide, or the ozone, in which areas is dementia more prevalent? Is it with one particular one, or one of these pollutants, depending on the map here, are the incidence of dementia higher in these areas? Like for your lower map in the west and the southwest with the ozone problem, is there a higher incidence of dementia in the west and the southwest versus the northeast?
In my previous paper that was published in the Lancet Planetary Health, we also made a map for the AD-RD incidence map. And we found that map has a very good, very good correlation with our PM 2.5 maps. So for AD-RD, we also observed a higher incidence in the Eastern United States than the Western. So it looks very similar to our PM 2.5 spatial maps.
Okay, so the higher incidence of dementia is more closely associated with the higher incidence of the PM2 pollutants. And that comes from things like automobiles, particles, factories, things like that. And that PM2 concentration is higher in the north, looks like the whole eastern side of the United States.
Correct. Yeah.
So chances are, if I lived and grew up in the eastern half of the United States, I'm more likely to have dementia than if I lived on the western side. Is that a correct conclusion?
So at least our study shows a link, an association, right? So higher exposure to PM2.5 levels, yeah, people are more likely to develop ADRD.
And that's like lifetime, not necessarily being younger. So to decrease my risks or my children's risk, if I live in these areas in that top map, if I move west, my grandchildren are less likely to develop dementia. Can I make that assumption?
Of course, if we assume all other conditions to be the same, right? And then, yeah, we can, yeah, you are more likely. Yeah.
That's scary. That's a lot of us.
Yeah. Yeah, so air pollution is definitely a serious environmental issue we need to think about. Yeah, we need to care about.
Okay, so let me see. Would diet, nutrition, and exercise in these other geographic areas affect the incidence? Would that have any ability to counteract the effects of pollution, I think is the question.
Yeah, so as I mentioned here, so air pollution is one risk factor, right? It's likely to be one risk factor for ADRD. And of course, there are many other factors that could also contribute or explain the cause of ADRD. Yeah, so if we have very healthy diet, right, we like do more exercise, that can be protective to this disease. And then, yes, they may have, some have positive effects, some have negative effects. They might be able to cancel out. Yeah.
Okay. I'm looking in the chat. So if we transition to electric vehicles, we'll see a corresponding decrease in dementia?
I think that's a very good point. It not only can decrease our exposure to air pollution, it also is helpful for us to, for us to like fight against the climate change, right? Yeah. So I think that's a very good solution.
Mm-hmm. So what about the fires on the West Coast, incidence of increasing the PM 2.5, or is it increasing the ozone pollution more?
So it can increase both, so for the wildfire, the biomass burning, it can increase both PM and also increase ozone, both. Yeah.
So in a couple of years, we're likely to see more people from the West Coast who've experienced these catastrophic fires have a higher incidence of dementia. Might that be the same thing?
I think so. At least I think for the wildfires, it is really, a very, another very serious like environmental threat that we are facing, right? It causes some troubles for, people are exposed to more wildfire smoke, PM 2.5, like more ozone, more other air pollution, and also, right. So yeah, a lot of adverse health effects could occur, maybe not only ADRD, and also like CVD, cardiovascular disease as well.
There is a question in the chat about lithium batteries. Does that have anything to do with either one of these three measurements of pollution? Lithium batteries, where would that fall? Is that a PM2 or is that an ozone question?
Battery. So what battery? Let me check.
Lithium batteries.
Lithium batteries.
Lithium, like I think they're thinking about cell phones.
Oh, cell phone. Yeah.
And computers.
Yeah.
They say.
I think so. Yeah. Yeah. So although that is not, my research area, but I think there are some literature also showing that there might be some issue caused by those batteries. Yeah.
So is there anything you'd suggest to help us minimize the effects of pollution wherever it is we live? I mean, we are wearing face masks, N95 masks for COVID. Would this help us at all with pollution? It's something that they wear in Asia all the time. Would these face masks help?
I think so. Yeah. So these masks, they can not only like help us like prevent us from exposing to those COVID viruses, but also can help us prevent from those air pollution exposure, right? However, I think this is not a long-term solution. Yeah. So I still think an important thing for the researchers to investigate is to identify which sources of air pollution they contribute more to the development of ADRD. So the government can have more specific policy on those, right? On those like air pollution related source. Yeah. So more targeted policy.
Mm-hmm. One last question I think I have for air filtering. A lot of people buy air filters, special kinds of air filters for their homes. Would this be something that might be something that stops? Would air filtering in your home at all be helpful?
Of course. Yeah. Of course, they're helpful. So here in this study, what we investigated are the ambient air pollution. So I'm talking about the outdoor air pollution that, as we know, we spent a lot of time indoors, right, at our home. Yeah. So I think those would definitely be very helpful for us to like mitigate the indoor air pollution exposure.
What about the use of plants? Can you comment on that at all? Indoor plants for filtering air?
Yeah, I think that is very helpful solution for us to, to decrease our exposure to indoor air pollution.
So take home people, one of the things that is real important is that, yes, using a face mask would be helpful, but a home air filter is important. And the third thing, we talked about indoor plants for reducing incidence of dementia. And something that we can do, what we might try. We have to do more study. And the question is, in countries like China, for example, they have high levels of pollution. Do they have a higher incidence of dementia than we do here in the United States?
So we haven't compared the ADRD cases in Asian country and in the US yet. However, I think ADRD is currently a global public health issue, right?
Yes.
It's a global issue now. So not only in US, but also in like Canada, in European countries, in India and Asian countries. Yeah, so all countries are now paying particular attention to ADRD.
Okay. You're not telling us to go out and get an electronic vehicle, but and I'm going back to that lithium battery question because the person who posed it said that lithium batteries are what fuels the electric vehicles. And I guess that's what she's talking about. So we get rid of one kind of pollution with the fossil fuel and we pick up another one by using lithium batteries, right?
So I think we will need like more studies to, see which one plays a more significant effect on ADRD.
Okay. All right.
Yeah.
So I'm going to reiterate and make sure that I'm correct, Dr. Shi. Indoor plants are helpful for filtering our air. You'd like us to think about getting air filters in our homes. And then third, consider using outdoor short-term assistance with pollution, maybe to continue to wear facial masks for filtering air, right? That's correct. That's what you're telling us, right?
Yeah.
Is there anything that you would want our listeners to assist you with at Rollins School of Public Health? Are there any meters or anything that you would want us to be aware of? Are there any studies that we need to be aware of with respect to pollution here in Atlanta?
Oh, I think, I think there are some like published literature, like looking at the local air pollution in Atlanta and how they affect ADRD. I cannot think of that specific paper right now, but definitely I saw some publications.
Okay, well, I think if that is it, thank you so much for being a part of this discussion. And again, Dr. Xi's presentation will be available on our YouTube channel next week. Please tune in so that you can go back and follow up. At this time, I think we're going to turn things over to Megan Nare to talk about Cognitive Empowerment Program.
Thanks, Dr. Parker. Thank you, Dr. Xi. And I am Megan Nare, like Dr. Parker said, from the Cognitive Empowerment Program, here to invite you all to participate in our virtual education webinar today. Each week we broadcast right after BrainTalk Live to present 1 hour of programming from 3 to 4. And it's really topics that we kind of present and work with every day at CEP, topics that are related to mild cognitive impairment, things like technology, innovation, lifestyle interventions. And today we're going to have topics that are about what neuropsychological evaluations are, what individuals can expect if they're scheduled to undergo a neuropsychological evaluation. And it's something that I know we always talk about a lot in BrainTalk Live, are all these kind of cognitive testing. So if it's something that you've done before and have more questions about, or maybe it's something that you've been hesitant about, but really want to know a little bit more information about, join us for one of our PhD candidates to share this week. Kind of the insider take and also how you can prepare. So thank you, Dr. Parker. I'm going to drop some links into the chat if you'd like to join with us today. You can just follow the registration for the webinar through the link here. And once you're registered, you can join our session that's going to start in just about 10 or maybe 5 minutes or so.
And thank you so much, Megan. And before we go, Ms. Deja is going to put in the chat. Megan's putting in contact information for the chat, and Ms. Deja is going to give you our program for our program next week. I think she can do that via screen share. Please join us throughout the rest of the month. The very last Tuesday in this month, we'll be hearing again from Dr. Seth Gale from Harvard Medical School. And next month, you'll have a couple more panelists from other institutions coming before you. So again, please follow up with our program. We look forward to seeing you next week. And I'll be giving you a couple. Yes?
Before you leave, can you give a little bit more context around what Megan was sharing to preface the neuropsych? I mean, we hear neuropsych, but like, what does that mean? Because we have a lot of new people on, and I know they'll probably go into detail, but I really want to key up what they can expect, because we hear all the time, like, how do I get a diagnosis?
So one of the reasons neuropsychologic testing is important is that one of the ways that we diagnose dementia in older adults is it's not just a little screening test you do in the doctor's office. It is that, but it involves a couple of things. You have to get a brain image, but a real important part of the diagnostic process is for you to do what I call intelligence testing or IQ testing for older adults. That's not done by a medical doctor like myself. That's done by a PhD psychologist, a clinical neuropsychologist who tests the different brain functions. There are 6 different brain functions that we're concerned about in all functioning adults. Deficits or deficiencies in 2 or more of the 6 brain functions gives you a diagnosis of dementia. Notice I didn't say Alzheimer's. Alzheimer's is a type of dementia. There are several other things that cause dementia. So working with a neuropsychologist, the medical doctor and the neurologist will work together to do some testing to better understand how your brain is processing information. So a neuropsychologist is a very important part of a cognitive evaluation. So next week, You're going to be hearing from Dr. Krishnamurthy, who's going to be talking about exercise and how important it is with respect to rehabilitation and strokes and how we measure that with an MRI. An MRI is one of those tools that we use for helping somebody get a diagnosis of Alzheimer's and related dementia. Does that help, Cornelia?
Yes. And so Megan has put that link in the chat. If you're already registered for CEP, you're good to go. They start right at the top of the hour. It is a different Zoom link. So if you want to understand and have better information about all the things that Dr. Parker just mentioned, hop on to CEP, our Cognitive Empowerment Program. If you are not registered, you have to grab that link and register. And once you're registered, you're good to go. But they follow our program every Tuesday at 3 p.m. Eastern. We are 2 p.m. Eastern every Tuesday. And I pulled the schedule up, Dr. Parker. Any closing remarks? Thanks everyone for your comments and your feedback. We do take heed to your feedback, and there is a post-event survey that goes out if you've completed it 1 time or 20 times. That again helps guide and shape our future content.
Yes, please sign in after the new year. This may not be available for everybody, so we need you to sign in, sign up, and show up when we ask you to. Consider volunteering for some of our research studies. Research participation is always voluntary, but it's also a way that you ensure that you get the best healthcare possible because you become a more informed consumer and more knowledgeable about the process of obtaining proper healthcare. So please tune in next week. Thank you, Dr. Shi. We look forward to seeing you all next week to hear Dr. Krishnamurthy. And the following week, we're going to hear from Dr. Gale, who's going to talk about dementias that have nothing to do with Alzheimer's and how lifestyle, how we conduct ourselves reduces our risk of developing Alzheimer's. If you looked at Good Morning America this morning, 10,000 steps is minimum for protecting your brain, and it reduces the impact or reduces the likelihood of your developing any type of dementia. 10,000 steps a day, that I learned. So I'm going to go buy some plants for my house to start filtering the air a little bit better. Thank you.